That bangs today, doesn't look awful.
Okay, we're getting started. Let me just get the agenda. Got all the stuff here. I think I passed it down for everybody else.
What do
Can
you
you
need?
pass me an agenda, please?
Here, take the one with the bigger right.
I sent it down for everybody. Thank you. All right, getting started. Okay, welcome everybody. This is the Human Services Committee. It is April 8th, 2025, 5:30 p.m. Hi, welcome. This is the Selectmen's Conference Room. So, roll call. Suzanne Walsh.
Here.
Wendy Crocker.
Here.
Kevin Matthews.
Here.
I, Cheryl Powell, am also here. We have a apology from Missy Kay. She's not able to make it tonight. We may still hear from Kim Crocker, which is why I am going to keep my cell phones open because often she comes in for this. I don't know the update on Patrick Downey, but hopefully he's in the makings of coming onto the committee. Am I leaving anyone out? I don't think I'm leaving anyone out. So what I'm going to do, that's roll call. I should make it clear to everyone, this is the first time, thank you to the powers that be at the meeting who have arranged for us to be on camera, because I personally believe all committees should be on camera. So just to let everyone know, the microphones where they used to be heard are not, the whole room is wired for sound, so anything you say can be heard. It is on camera, just so everybody is aware of that. Also, being heard and on camera and therefore as public record, hallway, stairs. So, just so we're all aware.
It'll be good.
Oh, and I also ask that people don't give out their personal telephone numbers either, simply because, I mean, we can get those or something like that later. We had one group of people that wanted to give us all their numbers and just say it out. And I said, you want to be on every telemarketer's list. Okay, so we've had the roll call. I am going to skip down to our guest speakers, who we are really pleased to have, and thank you very much. I'm going to ask them both to introduce themselves, and also whoever would like to speak first, or both, or whatever it is that you've planned, and who you're with.
No, I planned to
And the
just...
commissioners, committee members will please wait until they're done with their presentation for any clarification, as we do in other.
I'm Robin. I'm Finn Homeless Outreach and Engagement Team Lead. We are, well, I'll let Donna introduce herself.
I'm Donna Jackson. I'm the clinician on the team.
You said Donna?
Donna Jackson.
So we are a outreach group that aims to work mostly with folks who are struggling with severe and persistent mental health challenges that are also homeless. That's kind of the criteria for our program. We're funded by DMH. And we typically work with people for about 90 days. So we're a transitional program that really aims to connect people with any and all services that they're looking for and are agreeable to. So that is, can be mental health, medical health, benefits, Social Security and DTA. What else am I missing?
A lot of, some just, basic practical things they might need.
Basic needs.
Basic needs, and then, working with other agencies and at established outreach programs, and also trying to not duplicate services, which is why we're here. It's getting more challenging. The need is growing, as we definitely, the volume is there, and then also having nonprofits and state funded and town agencies, and how do we all work together. It's definitely, I'm new to this, and Robin can speak more to it, but I'm 6 months in, and so it was a lot coming in and trying to figure out who all the players were, and everything's acronyms.
Yes. Yeah.
Don't you just love those acronyms? Just to clarify for those who don't know, DMH is Department of Mental Health.
Mhm.
That's not only for the people here who probably do know, but also because anyone who would look at the tape. No. What is it?
So a huge part of how we start working with people is just building rapport, building trust with folks in the community by doing outreach and just meeting them where they're at, providing basic needs to start so we can kind of show, that we have some stuff that we can provide and just get a little like buy-in that way. And then it's all voluntary. So it's really up to the individual whether how fast they want to engage in services, and then at what level too. So it's very, very person-centered, and can be kind of at the pace of the client.
Do you have a website, by the way?
VinFin does. Our page is kind of under construction, I would
Okay,
say.
all right.
I'm working to get a little bit more information.
Okay.
On the page through VinFin, but if you Googled like VinFin homeless outreach, you should see a basic
BINFEN.
one page.
And we were talking today, some of what makes it, like, we're supposed to be transitional. So, 3 months is always a little hopeful, but usually it's longer than 3 months. We're generally engaged at least 6 months, I'd say on average, sometimes 9 months. And some of it has to do with establishing enough trust, and then also getting practical things in place like phones. People don't have phones, they don't have a place to stay. You can't just make an appointment, and people don't always, you make an appointment and they forgot they had the appointment, because if they're sleeping outside or they're, don't have stable access to things, they're just is not, their follow through is not going to be there. So it's hard to figure out, like, when we're handing people off, they have gotten used to us really being there along the way. Like, they're directing it, but we're really trying to do it with them, not for them. Mm-hmm. And that's the first challenge, because sometimes people want you to do it for them, and we're trying to do it with them so they can either feel that support, but also maybe learn the skill at the same time, or the confidence that they can do these things. At the same time, things are more complicated. You can't just walk into Social Security anymore. You can't walk into DMV anymore. All these things require phones and computers to have access. And so, and then people have a hard time explaining the situation they're in. And if they have mental health issues, they may have, be concerned about whether people are going to tell them what to do or how they're going to be perceived, or managing their own stress and emotions that come up in an appointment at Social Security or at DMV. So we do a lot of like there with them to provide support. And sometimes that's hard for them to then say, okay, we're just going to go work with someone else, And then whether or not that next agency can provide that level of support. We have to try and create reasonable expectations from them, like, someone may not fill out a form for you. You might have to fill the form out yourself. But hopefully by then, if they're feeling better about the situation, they're feeling like people are there to try to help, that you do see the people get more confident, and they do start to do more things.
Yes. Good question?
Sure.
No, I just, where are you physically? I mean, are you in a
Location,
building?
your premises.
Yeah,
we're
somewhere?
based in
And
off
then-
of Bassett Lane.
Where?
Bassett Lane in Hyannis. So there's a large
Okay.
VinFin office on
How
Hyannis
do
Road.
people
but we are-
find you, or how do you find them?
Yeah.
How many at a time? If they are unhoused, how are they housed? Well, I want to understand,
Yeah.
what quantity can you
That's a great question.
handle?
Yeah,
And you
that's
said
a
they're
really good
severe, they have to be severe mental illness.
Well, chronic and persistent.
Yeah, I'd say, yeah.
So
more
how can
chronic
they,
persistent.
do what you're saying? I mean, if you're trying to just be with them, can they ever function on their own?
Yeah.
Can we come back to that? And is there anything else you wanted to present? And that's one of the questions I wanted to be clarified as well. Is there
Yeah, I
anything
think
else?
Your
if some,
points and then
right,
Okay, so yes, if we can on that, because one of the things I have found, and one day I should think you have as well, is that once after people, you've helped them, is one, getting them to do for themselves, as you've already identified, because they've been so accustomed to living with the stigma, and then trying to get someone to help them, they don't want to let go. It's kind of like they're afraid any recovery they've had will totally go poof if they try to do it on their own. But also something that every single organization has identified is that once after you get people with mental health and addictions and homelessness in particular, those three,
right,
all those others that come into it, is the once after you get them to stand on their feet, and I'm not just talking about physically, I'm talking about emotionally and being less dependent, it's where do they go?
yeah,
And that's where the homelessness comes in, and it tends to be a cycle. Well, where do I go? I go back out on the street and I meet the people who want to sell me drugs, and I get the people, and next thing you know is they're back in. That's the pattern I've seen. You're shaking your head, yes. It looks like it's not an unknown.
Obviously, housing is a huge issue around
It is.
here. We often work with the shelter to help people get in there and then stay in there. So we'll work closely with people in the shelter too, so that they have some kind of stability.
You don't have your own shelter though. You use like St.
No.
Joseph's.
St. Joseph's,
They
yeah.
do such a fabulous job there. Betty, Town Councilor Lucky, organized for a number of us to go, and I had been there before. I actually did a TV interview there at one stage,
yeah.
but years ago. But the
So, yeah, and they're a nonprofit, so they're Catholic
Nonprofit,
Charities, and, so there was a handoff. My understanding is another agency did run them, and now Catholic Charities runs them, and then there's, so there's plans for them to now move over eventually to West Main in a new building, because that building is really needs to be.
460 West Main.
Oh, is that it? I was trying to
460
identify it
West
today.
Main, yeah.
So do you mind if I ask some questions?
Oh,
I
absolutely.
want to reinforce the question
Right,
that Betty just asked, because I'm still in my head, I can't get a feeling of how do they find you? Like, do you
Yeah.
have an outreach program?
Right.
Do they walk in your
Yeah,
front door?
let's
Do
get back
people
to
even
you.
know you're there? Like, how does
All
that?
of the above, yeah. So
Exactly.
we run with Housing Assistance Corporation, we run a weekly outreach event. It's a coffee house. It's every Wednesday.
With Hack, you said?
Yeah,
Okay.
yep, in Duffy, so we all partner in that.
Okay.
And at the church, don't you?
that's where it is.
Yeah, St. Francis.
At St.
Xavier
Francis X,
Church.
yeah.
So that's weekly and
Tuesdays, by the way.
well-known around the community, so, people can
Is that your
share the
main
word and that's
entrance
our-
point? Okay.
Yeah, oh,
Okay.
well, no, not not always.
Like, is that, how do people hear about you most?
We find our own referrals primarily doing outreach or meeting people also at St. Barnabas. So that's our other outreach event that Donna attends Tuesdays and Thursdays. They have a free lunch there.
Oh, in Falmouth. So you work across the Cape.
Across the
Yeah,
whole
we're supposed to
Cape,
cover the
yeah.
whole Cape.
Yeah.
That's the piece that's become, right?
How's your resources?
Well, we have 3 people on a 4-person team right now. We're working towards getting a 4th in.
Yeah.
And it's not realistic. I think people sometimes don't realize how big the Cape is and how long it takes to get from one place to the other.
Especially in the summer.
I was just gonna say, it varies.
Right.
So we tend to
So
stick in the higher population areas of.
so you have people stationed, or is it like, are you out of Hyannis and then you go to Falmouth and do some time there? You go to Harwich? Okay, I got you.
Yep.
Now you talk about 60 and 90-day programs. If you're talking with being homeless-centric and mental illness-centric, there could be some people that 60, 90 days isn't enough.
Not for housing, it's not gonna be.
No.
We're never, we really, and that's the hardest thing to say to people, they come in is, and Robin's really good at it, and I'm trying to get better at it, is we don't do housing. And of course, that's always gonna be the priority, but we can help people with understanding, because it's very complicated how many housing places there are, how do you access those places? And then if people don't have phones or emails, it gets even more challenging, and then they're not, and that's when we have to start to look at, if this person is not able to do this because of their mental health, they probably need DMH, right? So then at that point, doing a DMH application and still getting them connected to providers and services to try to keep them going, because it takes a while for DMH to come out and meet with them and decide whether or not to provide services. That's also voluntary. There's no involuntary DMH service. The person has to agree to accept DMH services, and DMH determines what service they're gonna get. We can make recommendations, but it's up to DMH to determine it. And they're basing it off of records. Sometimes we don't have
I was gonna
and
say,
diagnosis, right? And so a lot of what we can collect the records and the diagnoses and then provide that to DMH. We can make a case to DMH as to why we think someone may need services.
so,
Can I clarify something there?
yep,
One of the reasons that is when you can get a hold of the records is because the records that you're talking about, for the most part, would be protected by HIPAA and confidentiality probably.
Yeah,
The
but that's,
mental health
we just get them to sign a release. It's just whether do they remember, where were you hospitalized? When were you hospitalized there? Is it in state? Once it's out of state, it becomes a whole nother.
so with no blame, I'm just asking a question. How often do people slip through the cracks as we're waiting for DMH and they haven't gotten back to us yet? We're on 60, 90 days. Is that something that concerns you? Like, does that happen a great deal?
I guess 60%, something like that.
Say a great
I don't think it
deal,
happens a
to be
great deal.
honest. Like the people that we're working with most closely and need the most support, we're it's hard, but we pretty much follow
Yeah,
them
with
through
only
the
3.
process unless they're choosing not to receive services.
Sure.
So it's not really, in that case, falling through the cracks, just.
How many people do you
Not really
service, like, in general? How many people do you help at a
Well,
time?
we've started to realize our limits now, like, with the, and, because it's not just getting people enrolled in our program, it's all the case management.
Yeah.
And everybody's slightly different, and the need is usually high. And so after a while, you start to juggle too many balls and you start
Yeah.
dropping them, and then you're like, so we tag team a fair amount, right? So that we're supposed to all know who we're working with. And like right now, we have like 35 people, and that's getting up there. Like we're starting to drop a few, like just around like, did this person make this phone call? Did this person show up for this appointment? But in general, sometimes, again, like they set the goals, it's self-directed. Like we might make a recommendation, like this type of treatment might be helpful, or this particular agency might be helpful, but they're letting us know what they want to do. And it's totally voluntary. We're really trying to say at any point in time, you can change course, you can let us know you're not interested in doing, because we can't keep putting our energy somewhere where it's
Not wanted, yep.
You can't stretch,
especially
you
just-
don't have the time or the resources.
Yeah, there's 3 of you, for gosh sakes. You talked about duplication of services, and that's something that's always, for me, in my mind, something I think needs to be really figured out, because I think we have a lot of agencies here across, not only Hyannis and Barnstable, across the Cape, a lot of them doing the same things. And I guess my question to you is there anything we can do as a committee, as a community? Maybe it's a clearinghouse where everybody's in one, we all know about, all the services are in one place and you guys can share and talk to each other or that kind of stuff. Is there anything we can do to make that duplication easier?
I think especially for new players coming on board, like if you have new people coming in and how they get known, like how do you know where we are? I want to get back to that question, right? Like people walk up, we have an awning, so people will see the awning and just come to the door and then start talking to us. But like if someone starts a new nonprofit, there's no place for them to go. They can Google and say who's out there, who's doing this, but that depends on how savvy your organization is at social media. And so some of it is word of mouth. You start to talk to people and you find out who else is doing that. And then, everybody's trying to get funding, right? And if you're competing for the same funding, which, it does, like, if we're meeting the need, if the need is too high and the funding's not there, right? And then they have all these organizations, it would be helpful to know, all right, here's the people who are providing these resources, whether it's housing, mental health, legal, even hands-on clothes, I mean, we have the food and clothing stuff pretty
Yeah,
figured
like food
out,
supplies
but,
is
you know,
a
like,
big one, but we can, keep
Yeah,
a pretty good
that
supply
was
of that
pretty
stuff.
easy. This is where the database comes in, but we'll talk about that later.
So when you say services, in case management, can you break that down more specifically? So first, like, someone shows up, what if they don't, they aren't part of DMH? Is it?
oh, they're mostly not.
Yeah,
Yeah.
so we can't.
So you would start with kind of more traditional, trying to figure out whether they would be enrolled in DMH?
Enrolled in
With
our-
us first.
us first.
So we do have like an intake process, and
Okay.
it's separate from first an eligibility process, so we can have a conversation and get to know like if we're the right fit and the best program for somebody, we'll definitely, refer out and keep doing like the general outreach with most of the people that we initially meet. But from the eligibility, we can determine if like it seems to make sense to do an intake, and then soon after we'll do the full intake, which is
Hi,
kind of a
Patrick.
biopsychosocial. And then from there, we create an action plan. So all the goals don't have to be like directly related to mental health. I think that's, it's important to note, because we're often first meeting basic needs, doing referrals to the shelter, helping connect somebody to HAC, or for housing, it's either the shelter or like congregate living, or in referring to HAC. So again, we don't have housing.
And then how is the cost of those services if they don't have DMH, how is that covered?
Insurance, most people have Mass Health.
So it's through Mass Health.
They're eligible for it, and it's actually VinFin who are largely responsible for referring a lot of these people to DMH and helping them to get connected, so that then DMH can also help to facilitate other services. I want to acknowledge Patrick. Welcome very much. So glad. Have you heard from? Have you been put on yet or not? Because I believe that spot's. I've been chasing it.
The whatever begins with an A.
Appointments
The
committee.
appointments
Went in front of them, and then they said yes. Now it's up to the next people May 1st.
On the town council.
Town council, yeah.
You had already been. Excuse me for interrupting. You had already been cleared
Yeah, they want me to go again, I guess.
again. Oh,
This is a
okay.
new person.
Patrick, I didn't want him to be unacknowledged here. Patrick, we hope to be one of our newest members. And it's kind of been in the process because we had to wait till a seat became available. Welcome very much, and thank you for joining us.
Apologize for being late.
We totally get it. Sorry for interrupting you, please.
I had another quick question about funding. How are you doing at getting grants, getting funding? Is that a tough process for you to?
So we have a contract, like a 10-year contract, so it's pretty
God bless you.
set rate. We have, not very much funding for discretionary needs.
So we
Just-
do, so there's certain agencies will offer to do like a drive for backpacks and clothing.
Okay.
And that's, where it would be help, and people, they're at Wednesday coffee hour, like hopeful, are you with Hopeful Outreach?
Yep.
I'm Donna. Nice to meet you. So, Lisa goes, and so she'll say, we have these things, if you guys are short on this, and if we have stuff, she might come by and get stuff, so,
The organizations do share
Share,
resources
and-
allowed.
yeah.
That coffee hour sounds exactly like the clearinghouse I'm thinking in my head, of being able to have agencies say, here's what we do, here's what we have, and hear what other agencies have. Then you would be able to get that information or get the goods to the people you're working with, maybe easier?
It feels like the goods are less of an issue.
Yeah.
It's really,
We're just making the connection and setting up the appointment, or just having a contact there. So just having somebody from Duffy to sit down and talk with, who can then, call and set up an appointment for this person if that's going to be hard to do. That's kind of the aim, is just like making initial connections, and as we all kind of know what each other do, at least for like housing assistance and us and Duffy, so we can kind of like, guide somebody in the right direction to access.
Just to help clarify that for you, the generally to answer that question, it's not only Hopeful Outreach, you do a fabulous job, and I believe Patrick was one of the founders of that.
I am the founder.
I thought you had a colleague that you worked on it with.
We're co-founders. It was my
There you go.
idea.
Got it right.
I don't want all the,
I'm not so old, I don't remember.
so I share.
Please call me Methuselah. There's also another fabulous group that helps with that, are the main ones, and besides Duffy, and that's the Parents Helping Hip Parents. They do a great job with it. I know in my office, I frequently have somebody who comes in from one of those with, they look like, they remind me of one of my pre-med professors, head of the medical department, who would come in with these sacks all over him. He looked like Father Christmas because he's a Franciscan monk, so he'd have the long robes and he had all these things. It's the same thing. They come in and they have, here you go, there's a backpack for this homeless patient and for that homeless patient. And you open them up, and you guys know this, you probably pack some of them. It's a regular backpack. It's got one of the little metallic, it folds into something like that, but the EMTs use them for blankets when they're treating somebody like a car accident or something, wrap them on the
They
thing.
look like space blankets.
Pardon?
They look like space
They
blankets.
do look like space blankets. Yeah, and they probably are used in space actually because of the lightness of them. There's usually a couple pair of really good winter socks. Then there's toiletry things, toothbrush, toothpaste, brush, a spare bag for putting things, a small one of these towels that I'm trying to remember everything that's in it. It's a little bit like Mary Poppins, but the little towels that go into nothing, and it makes they're actually very, very nice. And a lot of these groups are actually paying off their own dime. So
But I think so much like there's asking people to provide those things is pretty set. Like that's and we could share resources and it would be help at a clearinghouse to know. But and there's enough conversations like, oh, we have backpacks. Oh well, no one has tents, and the tents are an issue anyways for the town and how but people are outside, and there is Duffy runs the program In From the Streets, which is a hotel program, first come, first serve. If it's below 32 degrees, people call and they can be put up at a hotel.
That's the St. Joe's shelter situation.
it's
So
not
Duffy
just
does
St.
the same
Joseph,
thing?
it's other
They do.
places.
Yeah,
So they both do the
basically
same thing.
Same
Okay.
thing, the same hotel this year was used, but you do have to sign up in different
To get
Different
around the
places,
freezing
yeah.
weather.
And
They
probably
both have
different
limits too.
different funding sources.
Yes,
Like
yeah.
one's a grant and one's
Does that
something else.
happen only in Hyannis?
There's a hotel
Falmouth
in-
too.
in Falmouth
What?
as well.
And they also have it in Yarmouth
Falmouth as well, so somebody else kind of helps.
I know, I've had patients who have been helped.
The churches do it in different
Yeah,
places.
yes.
You
Yeah.
said
I think
you
it
go
is-
to Falmouth. I'm just wondering, what is your experience in Falmouth? Because they have a human services department with the town. Do you engage with them at
Yeah.
all?
Oh yeah.
How do you engage with them? What,
So they run, they're not at the outreach program. The outreach program is sponsored by St. Barnabas, and it's a congregate meal program. And so they allow other agencies to come and talk and meet people, because it's a good place to meet someone if they're suddenly finding themselves unhoused or, living in their car. Depends how you couch surfing, whatever. And then, so different agencies are there and meet people, but Falmouth Human Services sort of knows what's going on there, because Housing Assistance Corporation will go and spend time in their offices or be in contact with them, with one of their social workers, Mark Abbott, and with the police department. And the police department has 2 social workers there, and so they're involved. And so, they have a meeting they run. So Falmouth, I live in Falmouth, so,
do you find
They're
that
very
the
well-
staff helpful in Falmouth? Do they add value to what you're doing?
what staff, the
The
meeting? or-
town staff, the town human
Oh.
services.
Human services.
Yeah, because they
Yeah.
provide, you can go there for therapy without having insurance, or if you can't find
To
a
the town?
provider.
No,
Yeah.
what she means is, I think I can answer that for, the connection between the various entities is basically coordinated through St. Barnabas, and also the Human Services. Human Services helps to make connections if somebody comes in, well, there's this, you found with the, you're talking about the counseling, well, you can go to Duffy for this, there's other areas where you can go for
No, I wanna
Duffy.
know-
Falmouth Human
I wanna know
Services
what
provides the
Falmouth,
counseling.
Falmouth
The actual
Human
counseling
Services.
itself.
So
Yes.
Falmouth
Yeah,
Human
Mark
Services.
The
That I
people
didn't know.
that work for the town of Falmouth
Right,
that
so
are in
they're
human
providing
service.
direct services.
What
So-
do they do?
So like they have someone who is 20 hours a week working with seniors. They have someone who they have a couple of social workers who are providing therapy. They run groups. They do educational programs out in the community. They
Yeah, they provide, they have other people that come in and might be counseling on financial services. So they have clinicians, they have LICSWs.
Right.
They do.
Yeah, they do. And
Like
so
3 of them.
people that are either underinsured or don't have insurance,
Right.
they can go there. So
and they have a wait list now too,
Yeah,
like everybody
yeah, of
does. But people can go in and like say, and they can point them in the direction of resources in the town. And one of the other resources is the Falmouth Service Center, which is a different resource, which is where the food and clothing and financial assistance, and has ours there.
I forgot about them, you're right.
Yeah, I mean Falmouth's kind of like Provincetown. Whenever you're at the extremes on the Cape
Yeah.
or in the islands, tend to start to just kind of circle the wagons a bit and just provide there. And Hyannis is a much bigger hub. It has a different feel to it. It has, the services are coordinated differently here. It's easier in Falmouth because everything somewhat has that centralized feel to it. Like you're in downtown. Everybody knows all the services. So I live in Falmouth. I knew all those services, right? And so if you have any familiarity with Falmouth, or you go to Falmouth, people will tell you where to go to get those services. It's, if you show up in Hyannis, that's harder.
Yeah.
That's
Yeah,
because
I
it's
think
not,
that's-
it's
Who
not
could make it
centralized.
easier? How could it be made easier?
Well, that's why we're sitting here with you guys. We're hoping,
That's exactly why we wanted you here, because we're trying to put together something to coordinate.
But they are hired by the town, they're not volunteers
the
in the
three,
human services.
yes, they're hired by the town.
Yeah,
And
20 hours
Falmouth's
a week.
unique that way, that it's one.
No, but
I know, I thought it was just one of them was
She just
20
said
hours
20,
a
that's
week.
why I'm
Well,
asking.
one
One of
was,
them
but
was,
they
yeah.
also have, I was an intern that, they have.
For seniors, they only have,
For
they give the
seniors,
seniors like, in which, they have one person who's dedicated 20 hours over at the senior center, but the
Oh,
other
gotcha.
20 hours she's at Falmouth Human Services. So, but then they have a couple other folks, and it's a great
They have
design.
somebody that specializes with children and
Yeah.
adolescents and.
I think the thing you said though is in my ears, and I think Councilor Lundke's thinking the same thing, is they are coordinating this stuff.
Yes.
They have a handle on everything going on in the town and where they could point people for
Right.
help. And that's what I think, that's what's in my head, is that I think that's an important part
I think
of a
it is
human
too.
services
Yeah.
department.
But
Well, they
the-
provide more traditional kind of social work or case management and getting people to the services. that
Correct,
they
yeah.
I met with Falmouth Human Services about 3 years ago to see what they were doing, and also met with the Falmouth at the Gosnold and that sort of thing. So this thing with the counselors there must be fairly, no? Because they didn't mention that then.
No,
She
no,
didn't
like-
mention it then. She didn't mention it then, okay.
At least maybe a decade, maybe longer.
Really?
Like maybe 30 years.
Okay, so
Holy
maybe,
cow.
well, I was talking more
Only
about,
25,
actually, when
that's
I met
crazy.
with her, I was talking more about the opioid and the homeless thing, so that may be.
Oh, yeah, no,
That
they
may-
definitely
yeah.
have done more now around homelessness in the last
Yeah.
few years.
It wasn't about the town that I met with, it was about the homelessness with the opioid situation and dealing with funds and how it mixed in with mental health. So, it's accurate then. So, any other questions from the committee members?
In working with your work with the homeless, I know this is sounding like a broad general question, I'm just trying to get it in my head. Do you see more homeless cases because of people who might have either addictions or mental illness? Is it a situation where they lost a job and now they have nowhere to live because they can't pay their mortgage anymore. What is that percentage, or what does that kind of break down to?
It's a tough question. It's a combination of all of them, I think, just with
Yeah.
housing costs going up. There's more people coming to the Cape from off the Cape now too. People coming from Boston. So there's been a lot of new faces.
A lot of
people.
Yeah.
So-
It's hard to
That's
tell.
coordinated,
It is.
though,
I mean,
isn't
they're coming here and they're already homeless?
what I was
Yeah.
gonna.
Yes.
Yeah.
Why would they do
They're being
that?
shipped here or
Because other shelters
Word
are
of mouth.
full. They hear
From
about
New
St.
Bedford,
Joseph's.
New Bedford,
There's-
Fall River.
Missing
But how did
Boston.
they get
Not
here?
Boston, so
shipped bus ticket.
Yeah, other agencies will buy bus
So New Bedford, I've heard this before, that's why this
Yeah,
doesn't surprise
I
me.
have too.
New Bedford will say, hey, go to the Cape, here's a bus ticket in one way and have good luck.
Boston, I've heard the same thing with regard to Boston.
Yeah,
and
no, sometimes
out
people
in
get
Eden.
on the bus or the train, or they have a car and they decide there's reasons they want a smaller area, or they want
Oof.
I wouldn't,
Stop it.
What percentage is this?
oh, it's not, I wouldn't,
I would say it's like,
I'd be
it's
more,
not,
more
It's hard to
specific.
tell.
it's hard to
It's
tell.
the
really
numbers-
hard to tell.
There's been an increase of the elderly homeless.
Yes,
That's gone up a lot. I know that percentage has gone up.
Yes.
and then like 20-year-olds, I see like
We're seeing-
newer
yeah,
20, like
and
just
then
early
books.
20s,
A lot of the elderly, or a lot of the 20s, sorry, tend to be, a lot of those, not all of them, but addictions, having left school, having no job, really having no direction, families saying, you can't stay here anymore, you have to get out and take care of yourself, and also coming onto the Cape and not having anyone here. I think it would be impossible to say that there's one category that fits all. There's a lot of overlap. People that are elderly who have suddenly become homeless, people who have come from off Cape, people who have lost their jobs, people who've had addictions and therefore their families have kicked them out. There is no exact people who are veterans who have no place to go. I mean, this is not a one size fits all.
I mean, the other thing is our lane is if you have mental health issues, so we really cannot speak to the broader homeless
Yeah,
population.
Gotcha,
Because we really are, that's where we're zoned in on,
yeah.
so I don't, if I did that, I just come back to that because that's.
And what's your percentage of, quote, graduation? How many end up in a long-term solution? Like, that they're solid?
It
I mean-
depends on if you're referring to housing or like being connected to services long
I
term.
mean, someone
since-
able to support themselves or being supported in some sort of group home I don't know, what's your definition of success? I mean,
It's hard. That's a hard
Yeah.
question.
ideally, you'd want to be out of business. I mean, you never
Right.
will be, but
Yeah.
how many do
We
you?
won't be, because the
don't
housing
always-
issue isn't,
Yeah.
it's not gonna change, it's, and mental health. The VinFed started post deinstitutionalization of state hospitals in the 70s, 80s. And, and now if people can't access services, if they don't have housing, if their basic needs aren't being met,
You need
and what is
measures.
success, right, for a 3 to 6 month program? For us, I would say it's making sure people feel, first of all, that they're human and they're cared about, and that to not give up hope. And that's why people use hope in their title a lot, right? Because it's, you feel like, and then also that you connect them to services that hopefully they can access, right? And so they have a phone, so they can do telehealth if they can't get there because they don't have transportation. Or they, if they qualify for DMH, and we're trying to catch some of the most vulnerable folks and be like what we're considered a least restrictive, low barrier, low threshold program. Which you meet people where they're at and you start with where they are.
But does DMH have housing?
Yes, but not immediately. And, for some of these folks, if they're have severe mental illness and they're in the community, they're vulnerable and they're at risk. And so we do try to identify those folks, and ideally, if it's voluntary unless you can section people, but can they go to Pecasset? Can they go somewhere else and stabilize a little bit and then work in a program that might eventually get them supported housing?
So we don't do the direct referrals to DMH housing. We get them connected to DMH and then it's kind of on them. We help with that warm
So
handoff.
is that when you're done, once they're connected with DMH, you're done?
Yeah, so we can't be connected for too long. Like we can have a couple weeks, a
What
month
if you don't
to
connect them with
transition.
DMH? How do they exit your program?
It'll be voluntarily, or if all of our goals that we established are met and they feel connected to the community, whether it's getting, just all based on their individual goals. So whether it's
Okay.
moving to the shelter, getting a therapist, like just the,
It might be helpful, and I probably should have done this at the beginning, and I apologize that I didn't. Both of you have met me, but you haven't really been introduced to the other people here, so you get an idea of what our backgrounds are. And then I just said a couple things I wanted to say. So, Patrick, I'm going to start with you.
I'm the president slash executive director of Hopeful Opportunity Cape Cod, and I work at Bay Cove too.
And Kevin?
Kevin Matthews, I work at iHeartMedia Cape Cod in the Senior Vice President of Programming. I'm here basically, I hope to be here to use my big mouth and try to do as much as I possibly can to help out in the different services that our communities need. I've worked with so many charities in my 35 plus years in radio. I think I have a knack of being able to work with them and try to come up with solutions that work for all of us, the town, the agencies, the people in need. And I just want to help as much as I possibly can to do that. So.
Well said. I'm Wendy Crocker. I'm an LICSW. A lifetime ago, I was an intern at Falmouth Human Services, which was wonderful. And I'm here to hopefully make a difference in this community because we are very disjointed in the different services that we offer. And it would be wonderful to try to advocate and to, we were hoping to create a database and to make sure that people had access to the resources and to advise our town council on what we offer in this area.
And we're going to, I'll come back to me at the end. Suzanne?
I'm the new kid on the block. I'm here because I fall into the old and decrepit category, so I can relate to the elderly. I worked in doctor's offices. I've been a hairdresser that I traveled to homes and would go in and find I had to clean bathrooms because as their vision went down, they don't see what's happening. And I'm a real advocate for the seniors. I feel we get overlooked, or they get overlooked because of homelessness and addiction, and those are the main problems that people really go out and try to solve. But these little old people that don't get on to a computer, that don't know they can get on the Town of Barnstable website and find out some of these things that would help relieve the problems they have. So that's what I am here. I want to be the Lone Ranger of the elderly. How's that?
That's very good.
I owe silver.
Yeah. Where's Tonto?
Yeah.
Good question. Betty, you want to go
I'm
next?
Betty Ludke. I'm a town councilor for the town of Barnstable. What the town council does is they have liaisons to all of the committees, and I am the liaison to this committee. So that's why I'm probably asking more of the questions about the value added by having the Human Services Department. Mm-hmm. So I try to seek out how the town can better engage, better coordinate these different services. I have never worked in this field. I was in the military, and then I flew airplanes. So that's why I'm probably asking maybe some ignorant questions. But this is very new to me, but I try to take the 10,000-foot view of everything the town is doing to see where things fit in.
That's the pilot side of it.
Yes.
Bird's eye view. Betty's being very not modest. So I'm the longest member on this committee. I came on 3 years ago, this coming May, so like next month. And I became chair that same month, and things have changed. But one of the things we did was to take our purview, which is to try to coordinate services, and that had not really been done. So we have spent the last 3 years getting together with various entities, the police, the fire department, relief, outreach, Bay Cove, Duffy, hospital, Cape Cod Healthcare and all that, et cetera, NAMI, I know I'm leaving a lot out. We had a problem with quorum for a while, for about 5 or 6 months, because some of the people had left, and we brought new people on, people who, that are wonderful that are here now. And we're trying to put together that database, but also to coordinate within the areas that service this population. I have been in the mental health field for roughly 17 years now. I am a licensed mental health clinician, LMHC. I'm also an MACCS, which is a Massachusetts Certified Counselor Supervisor capacity. Prior to that, I spent 16 years, mostly in Europe, as senior editor and editorial manager of an American newspaper, working with the various American embassies and coordinating that and coordinating the American public overseas. Prior to that, aside from being a mother and married, I was an RN, and I specialized in oncology and cancer research hospitals. So,
Show off.
I know, I want to add to mine.
fine,
Can I
I'll
go again?
go
No.
back to you next. So that's, but what I can see working with mental health is, we're starting on that database. We had to kind of go back to the drawing board, and we're trying to bring in the various entities. And that's why Human Services Department coordinator, whatever, comes up every once in a while. Well, how can you do it with this, because we don't have a human services person or whatever. But I deal with, I'm not an LADC or specialized in addictions, but I think the people who do work in that field are well aware that there's usually a comorbidity, which means addictions are often linked with the various mental health, housing, and all that kind of thing. One of the things we had started to work on is not only a database, but it's also to, in coordinating, try to put together a program. And before we had the problems with quorum, we were trying to put together a system whereby we came up against a stumbling block most people have, and that is, what do you do with them when you help them so far? How do you keep them going that direction? And and homelessness was a huge thing, and lack of supports. So, and that's how we got to know a lot of the various entities within the community, because we kept, this will help, that'll help. So one of the things we had come up with was various tradesmen who were willing to help people once after they were, let's use the addiction, stroke, mental health, provided they didn't have a history of super violence or something like that, where you really couldn't pair them up in somebody's home, is to where these tradesmen had offered electricians, carpenters, plumbers, and that, to try to help train them so they can have some sort of work background, get a little bit of money, bring in some of the restaurants, because a lot of times they have to write things off, where they would help, and so they could give decent meals, and to try to address various things. The one thing where we would hit, and still hit, one of the big snags is housing. That's the big stumbling block right now, in my opinion, one of them anyway. But there were certain suggestions that were made in that aspect. So what we're doing at the moment is we have to report to the town council pretty soon on what we're proposing, because our task is to come forth with a report on what the difficulties are, but also see how we can coordinate it, and to make a proposal to the town council for consideration as a possibility of what might help to the community to address some of these, rather than each entity doing the very best that they can, but doing so in isolation, and oftentimes competing with one another, or having services that, you know, you have to really know who's doing what to try to coordinate that. So what we want to do very soon is to have a joint meeting with everybody who's come to us. We also have police, fire department, because we all know they handle most of the 911 calls. But we also had Cape Cod Hospital, I forgot about that, and Cape Cod Healthcare. Oh, and also to admit, you put your hand up and it made me remember something. I've left 2 entities out, or not entities, committee members out who, Missy K, Sherry K, who was unable to be here tonight, sends her apologies, who has a big background with government, and she worked with the Attorney General's office in California for quite some time, and I understand she wrote grants, and worked with the business entities in the bid and such like. And also Dr. Kimberly Crocker-Crowther, who is the recently appointed, 6 months ago, I think, Patrick, the new medical director of Bayco. Another fabulous individual. She usually phones in to be at the meeting. I don't have my phone blocked, or I'm not quite out. So that's where we are with it, and very soon we want to have an overall meeting. I'm going to try to get the big room for us to see if we can start, and over the course of about 4 months or something, put together an initial proposal for consideration, and see, you know, if that's acceptable or not. A lot of people have gotten to the point where they're saying, as we've heard tonight, if they had one person to direct human services, like a lot of other, like Taunton's done and Plymouth has done, and Falmouth has that for things to kind of fall under and help, but we don't have that, so we have to work with what we have. But that, did you want to add to yours?
I belong to the International Alliance of Theatrical Stage Employees and Motion Picture Operators of the United States and Canada. How's that? I threw out a lot of initials.
There you go. Okay.
Oh, go ahead.
Can I ask a quick question? Oh, no, you know what, Patrick, you've been patiently waiting. You go ahead.
When you said the Cape Cod Hospital, so Hopeful Outreach just signed a contract with both hospitals to be in there for recovery coaching, recovery navigating for when people overdose or come in with
That's right.
alcohol or any type of substance abuse, that we can get them sent to detoxes on and off Cape, or work with all the agencies, and then collect that data too. That's what I'm biggest after, is like I want to help people, and the second biggest is that data. I want to know how many people are actually getting help, and we're going to do long-term follow-up with them. So it's not just they leave the hospital, like, I'm following up with them for XYZ amount of time, so they're getting the services they need.
Yeah. And isn't that, correct me if I'm wrong, the, how's it I understood that right now the hospital has hired for April, May, and then a reevaluation at the end of May. Of course,
Yeah.
I'm sure it'll be outstanding.
It's
but-
supposed to be at the end of May, or end of April, we're supposed to reevaluate when we bring the numbers back. But they go back and forth. It's been a rush to get us
It's a
in.
vertical learning curve. That's
It's
fine.
a learning curve for us, and then it's a learning curve because I won't name the agency that was there before us because I don't talk bad about agencies, but they were struggling to do their job. So we're coming in fresh to be able to give these services that, we have built connections through all the detoxes on a name basis. So like I can give you one a detox pretty quick. Not to stroke my own ego, but within 5-10 minutes I have somebody in a detox in Massachusetts somewhere.
I know the background on why that changed from what was happening before, but it's not here nor there in being pertinent.
It's not my
at the moment.
business to.
But the thing is, what Patrick is saying as well is that what they have directed it specifically at is the problem that would often arise is we're going to refer them to therapy and then we're going to send them out, whereas they either show up. I mean, I get a lot of them referred to me and they just don't show up. So it ends there and they go back to the cycle. We're back to once after you stabilize them, where do they go? That's one of the snags. The next, I mean, there's a lot of snags, but that's one of the big ones. But another one of the big ones is after they're doing better, how do we keep them from going back from
Well, and
different
this will be
stages?
interesting, because if you do follow people,
They
so
do.
this is, you know, so
They-
if
they're
people go
addressing that,
through a detox, and then if they refuse step down, how do you track them? Because it's not uncommon for people to say, or, you know, there's only limited scholarships for so many weeks for sober living, and people don't have an income to pay for sober living, so they maybe, you know, maybe they do the step down and maybe they go to sober living for 2 to 3 weeks, but then what happens to them after that? And a lot of folks are using cannabis, which is legal, but then that means they're not eligible for 2 of the transitional housing programs. So, and we don't even like bring in cannabis anymore, you know, because we are focused on things where people can die from opiates and alcohol. So that's why insurance will pay for your detox, but there's not a lot of cannabis treatment, and then that affects your housing. So, you know, I think your background at we have to take a bigger picture look, and also what populations are most vulnerable. So right now there's a system, HMIS, and which is the homeless,
I forget what it stands for, but
homeless
it keeps track of the homeless.
inventory maintenance systems. I mean, not
The C I'm
maintenance
forgetting, and then it's information system.
system. So it's keeping track of people, and
Who's doing that?
But,
The who?
Yeah, but who in the
Yeah.
town? I know it's being done, but who in the
The
town is
town.
responsible?
Our
It's
town?
the county.
it's, what's his name?
County.
It's county, isn't it?
Yeah.
Great, yeah.
Yeah, it is county, because I didn't know there's anyone in town at Barnstable.
county?
It's the
county, right, so I think
County's
you have
doing
to, right, so like, so it might be a county thing and a town, you know,
What's a homeless person?
someone, no, they do define it, so it's
No, how do
defined,
they define a homeless, how do they?
that you've been,
Where are they?
they have 5 categories. of
Yeah,
living.
on the streets, couch surfing,
Living in your car.
living in a tent, living in your car.
Yeah, but how can they possibly have accurate data? I
So
mean,
they do
It's hard to
counts.
gather for sure,
They
but
do counts once a year, and then you can add to the system too.
yeah.
Actually, Betty, that's the county report in front of you that
Okay.
because I met with county and I'm gonna be doing so again.
So
One-
it's
one of
roughly, you know, you can't know for sure, they do what they call a point in time count. So
Oh, okay.
anybody who's service providers out in the community having contact will document all those folks that they know as of right in that moment that they've collected data on. And all of it's supposed to be HIPAA compliant, so people are supposed to all sign, and people are signing forms saying, I know you're listing me in this system. That was a glitch for a while, was making sure people had informed consent. We are gonna take your information and we're gonna put it on this system of
who
care.
uses this database?
It's like 5.
About 5 or 6 agencies, so we're considered like first point of contact, so we're supposed to do this
So
assessment.
you get a
with-
person, you then look up
You
in
can
the
look 'em up.
system and see if they're in there?
Yeah, so I could look up and see, oh, okay, this person's connected to.
Can you see
Patrick.
if they're being helped by another agency?
Yep, you can see if they're enrolled in the program, so it's.
Because I was
us,
gonna ask
the
that, I know you
shelter.
deal with that specific, your genre, but is there an amount of people who go to, the same person going to multiple agencies to get help, to get tents, to get clothes, to get food, whatever the case is, instead of working with one, they work with multiple?
We all do different things. so there's
I'm
not
sure it's
really-
happened, but
Both,
What about these people
Not
that
that
are
high
moving
functioning.
around? What about these people from New Bedford? Maybe they got counted here and now they're here. Can you see that in the database?
No.
It just, for the count,
Wait, so
It's
you
it's
just
just a
have,
one night thing,
Yeah,
so for the
right.
yearly count, it happens one night a year, so it's in that way, but.
but you use this database. You use it. I mean, you can see it.
On an ongoing basis, we use it, so if we meet someone.
Do you
and
add them? Do you have
Yes.
authority
Yeah,
to add them?
Once they give us permission to, we add them. And then it's supposed to assess for risk
wait,
and
is it-
vulnerability,
But how
so
far
that,
does the database go? I mean, is it regional? Is it,
no, it's just.
I think
Yeah.
what Betty's
County.
getting at,
Yeah.
I think what Betty's getting at, and correct me if I'm wrong, so how many people and how many entities have access to it, but you would have to have, in order to have access to that, because I'm sure it's, not anybody can get access to it. It's because of the HIPAA thing, so you'd have to be in the system that is agreed to be able to use it and access it in order to be
Right.
there, which is part of probably this
I
thing that they
guess my
sign off
point is
on.
you said people are aware there's openings here, so they send their homeless. how are they?
I don't think that's really happening. I just wanna say for the record, it's not a huge
I'm
amount.
just
It's
wondering
not
if
like
this
people are
database is
showing
a-
up in.
It wouldn't show up in the database, and there's only like a certain amount of seats that are like tickets, I think, per agency, I think, or there was only a certain amount last time, cause like I only have 2 for mine, so only 2 people in my nonprofit have access to HMIS. So.
You have to send in your information to someone who oversees it and says, okay, you can have access for adding people and seeing the information, cause it's date of birth, social security,
It's very personal.
and, yeah,
Yeah.
and they have to report their mental health and their substance use and domestic violence and any other things that might put them at risk,
Is
their
it
age.
a national database?
It's a local database.
I know, but the local feeds up.
No, it can't, because you have to be HIPAA compliant.
It's for all of us to use, so we
It's
can.
Cape Cod? It's
So
Barnstable.
through that
It's whoever's
system-
on this particular system with an agreement that they have access in that particular system, correct me if I'm wrong. But you can't just you can't just say, I wanna be on that and download the software. You have to be vetted to be on it and know that you're acceptable to be on it.
I'm just
because-
trying to find the value
The
of this
value, right.
database,
So-
because it sounds like it's,
A big part of it is that there's some programs can pull, this list helps determine priority. So based on disability, substance use, mental health, chronicity, you get a score. So that when we do this assessment, there's a score at the end, and if you're over, I think it's 14, you're determined to be in the
but
high
if
priority
I'm in
category.
Falmouth looking at this, can I see Cape wide? Who am I
Yeah,
seeing?
it's through the whole Cape. So
You see,
just
so
through
it's
the Cape.
the county is the cap?
Well, Dan Gray is the one who
Okay.
decides who.
yeah, I think he'd be a really good person to like come here and connect with. I was just talking to
DM
him.
Gray?
Yes, through the county.
Dan Gray through the county.
He has a wealth of knowledge of that process and he worked with BinFin like 20 years ago on our team. He's worked in a lot of different agencies and has a good,
Some of it's looking at,
understanding.
right, chronicity, like if someone's been outside for over a year, living outside, or for more than 4 times in the last 3 years, and if they're vulnerable, so if they're over 60, if they're a vet, if they fleeing domestic violence, we want to prioritize them in terms of access to services, particularly to safe housing. So it's supposed to prioritize.
so we have case conferencing that's just started again. So there was kind of a pause on all of this. I think it kind of fell apart a little during COVID and it's just building back up. So there's different programs, mostly permanent supportive housing programs that can see this. The county will say, hey, this person's at the top of the list, and then we can talk about what would be the best placement. So HAC can say, we have this program with permanent supportive housing. We can offer them, it's a separate, like a project-based kind of voucher. It's not like a Section 8 or anything like that. So it's helpful to help place people in the most supportive environments. So that permanent supportive housing could have regular case management.
I'm surprised they have permanent supportive housing. I would have thought it'd be more gradated. You know, you have this for so much time, and you can move on to this higher level or go back. But that's whatever they determine. But I'm just surprised.
So there's HAC, Sandwich Housing Authority. I think it's Housing First, or not Housing First
HAC has presented to
We have
us as
another-
well. Yeah.
group. So it's a confusing process. It's taken me a long time to understand the purpose of HMIS, and it wasn't really being used much when I started. So I think it's all kind of new or regenerating.
I guess about HMIS, so there's only a handful of agencies that can use it, that is allowed to use it?
Yep.
So,
They're access points. So people that are considered to be the first point of access for somebody who's unhoused to
Okay.
make the first connection.
how many access point organizations do you think are there?
So they consider, it's like 6 that are part of the HMIS. It's only 6 agencies that can access it, look up the information.
So Catholic Charities with St. Joe's, would they be on that?
They are not, they don't do the assessment, which I'm not really sure why, because they are usually the first point of
They're an access point,
contact.
yeah.
Often they are.
Uh,
Well,
so
they have
they
to
do-
annex it.
How
without,
do they get their people in if
so
they're
they
not?
put people in, but they don't do the assessment to determine priority or chronicity.
Because they're just a shelter, they don't have a.
Does the
clinician.
Barnstable Housing Authority have access?
I think
No.
just, can we,
No.
who are the 6? Are you allowed to tell us?
Yes, might know off the top of my head. I just got the list. So
Probably know
it's
some of them.
FinFin Homeless Outreach, Hack Homeless Outreach, Hopeful Outreach, Duffy Health Center had their Housing First or case management. What else we got?
3 of those I would have get.
I think
I would have guessed.
maybe the islands, maybe Harbor Homes. Do you remember that? I have a list I can share with
Yeah,
you,
no
but
Interesting.
there's like 2 others.
And this is just homeless, the only homeless people are.
I just got on the Barnstable County Islands, I can never say it, Homeless Policy Committee Board or something like that, policy board. So like this is the type of stuff I could bring up to them. I was like, does HMIS need to be expanded or whatever? It was like off topic, sorry.
Would homeless not hopeless be one of those? Or not? No?
They're not.
Oh, they're not Catholic
So
church.
the main thing is, it does, because I'm a psychologist by training, and I think people who are in the position of being unhoused are in a vulnerable position, and if they're more willing to just give away their information in the hopes that they're gonna get services. But that means that the onus is on us to make sure we still are protecting that information, because that's information the rest of us will protect. I'm not gonna randomly just give you my date of birth and my social security number. But when people are in desperate situations and they feel like I have to do this to gain access to something I need, they're going to share that information. So we have to be really, I think, doubly sensitive and careful around if that information is in a database, who has access to the database, and do they understand HIPAA, and are they using the information, in the service of providing access to housing or whatever it is, the purpose of gathering the information, that we're gathering the information for a purpose. And is that information being used for that purpose and not misused for other purposes?
I guess then my question would be, if someone goes to an agency that's not one of the 6, does someone say to them, you have to go to this agency to register on this HMIS because we don't know you're here?
No.
Because you're none of the 6. I guess that's like for example, Homeless Not Hopeless, I know the person who runs it is a good friend of mine. They don't have the database. So how about if someone goes to him and needs help from him and he helps them, but they don't get on the database because he's not part of the database program? Like, I guess, how does that work? To make sure that everybody who's homeless and needs help gets on that database.
So that need isn't assessed or
It's
identified
not
in the
yeah.
community. So it's maybe not an accurate picture, or if somebody chooses not
Right.
to disclose their information for the database, so we don't have a true count of how many people are in need of support.
Exactly. It's an estimate, and
Okay.
it's a rough estimate, and it's an attempt to do something so that we're keeping track of especially the most vulnerable people who've been out there for over a year and either have substance use or mental health issues that are contributing to the reasons that they are unhoused. And how do we then connect with them and provide services? And are we connecting with them like at a point of access, like at the emergency room, when they're in crisis, when you can probably get them to do change a little more readily? And then are they falling through the cracks? If they're not being followed up with, and then they're just backing around again, but it is a housing is the main thing that everybody wants. And so
I'm still really struggling with how they find housing. So
it's a lot of waiting.
where do they go?
A lot of times they don't find housing. There's a lot of people living in their cars. There's a lot of people that are just couch surfing.
The unfortunate part is there's nothing this committee can do, or the other committee I'm on can do necessarily about housing. I mean, that's a much bigger, much more fish to fry. That takes a lot of money to
Yeah.
build a house.
I know, but is this free housing? Is it completely subsidized, or are they getting a job and being able to support themselves? I don't understand.
Betty, it might be, I'm kind of thinking when you talk about the population that you serve, the individuals, a lot, they're identified as chronically mentally
Right.
ill.
Yes.
So
That's
it's not, when you say, do they graduate, or we might say like, are they discharged? But you know what, a lot of times, you know, the reality of somebody who is really struggling with mental illness, you know, sometimes they're going to maintain and they're going to do well, but the reality of that is they're going to need supports, and it's going to be very
If we don't
inconsistent.
have these institutions, where do they live? I don't understand.
We do have some of these institutions where people, like Champ House and other places like that, group homes.
that
Not
it?
enough of them, but there's
not
also
enough
different,
to meet
there's
the
also different types of people who need housing. There's people who have lost their job, can't keep it going, and have 5, 10 kids to feed and whatever else, who don't really come under the categories that we're talking about. So there's different types of people needing them, but there's also, within this category, which I think is a good number of them, there are some group houses that they can go to that deal with other aspects of some of these. That it doesn't, not everybody falls under all of them. They fall under a number of them, but we have identified the umbrella ones: the mental health, the addictions, the housing, the mental, the.
No, I'm just thinking in the context of we're now doing our housing production plan.
Yeah.
And everything there is subsidized housing, has to be below 80% AMI.
Yeah.
I would think these people are below 30% AMI or 0% AMI.
Yep.
How do we address that? How does this housing get created? Is it always
Charities.
supported by charities? I mean, do they
Or-
end up, that's why I asked
or
if the Barnstable
state,
Housing
or the
Authority.
state, the
Yeah.
charities or the state.
Yeah.
The Barnstable Housing Authority, don't they
And
have
the
some of
churches.
these?
Yeah, they have,
Charities, churches, and the state, yeah.
But the
Like
wait lists are always
project-based.
long too.
Yeah.
You know, so
And
maybe
that's-
on
it's
every-
on pause.
So when you say a wait list is long,
It's-
give a time frame. Be even more specific. Years.
5 years, 7 years.
Yeah.
it
I've
just
seen a number
depends,
of 3
Yeah.
years.
You know,
A lot of
It's-
places won't tell you because it's really hard.
Well, what
Yeah,
happens
estimate,
is somebody will be on the list. Then a friend will let them in, then all of a sudden they'll think, well, they don't need it right now because they've got this friend that'll have it. Then you'll end up with somebody who says, I'm not using I'm away for the summer or for the winter or something. Here's the keys to my car, there's no gas in it, but you can stay in the car. You get a lot of people, I've had a number of patients with that, they're staying in a car even in the winter because they don't want to go to the shelter because the shelter has other rules. For instance, I have a number of people I would see who, I remember when I first started dealing with it was, I'm just starving, and I felt, so every time I'd see them, I'd say, hey, here's a sandwich. Here's a sandwich and a cup of soup. I can't have it. Why not? Because I have to share it with everybody else at the shelter, and we have to divide it up amongst us. Okay, can you just have it here? But there's so many different variants to this. So that's why I'd come up with some sort of plan, but you can't say that there's not enough data to say there's 30% in this and 50% in that. There's only vague guidelines that people are trying, like what you're trying to do with that database on having
Yeah, well,
a pretty good idea
Yeah, I
what's
mean,
happening.
but different people are starting to develop other programs,
Yeah.
and I was, my hope is if there's some sort of like place where people can go to see what agencies are providing what services to
Yes.
what
Yeah,
population.
That's the
to
database.
what
That
a nice,
population.
That's what we want.
clear
Yeah.
Because, to be
database
honest with
that's
you,
updated regularly.
we have like a
Yes.
baseline right now of what our new guidebook is going to be, and service book is gonna be. VinFin's not on it. So I'm glad you're here today, because I really
It's
knew
on
nothing
Yes.
about your organization. And what it does, again, this puts it in another aspect, because this isn't about you need clothes, you need food. You have a homeless-centric, mental illness-centric situation where you help them find services, benefits, stuff like that they do. And that helps us, at least it helps me, because now I've got you in that box. I know what you do now. And when it comes to this, I keep calling it the clearinghouse, but when it comes to that, that's the section you're under. So that way when people are looking, or when a human services director says, okay, I need to look here, that's where they would look, because you're in that quote unquote box. I don't need to put you there. But that's what I think is so important, that we need to come
Yes.
together on.
And there's a lot of clearinghouses, so to speak, as you call them, because they come into the system from various different angles. But then oftentimes what you're looking at is at the same ways to send them, so there's
Yeah,
just not
exactly.
enough of them.
Because Homeless Not Helpless, they will help with shelter. Another organization will help with clothing and stuff like that. Maybe another one does food kitchens or something like that. So there's different areas where we can get people help. I think again, please, if I'm wrong, everyone say, I think we're trying to put together a clearinghouse that shows where these things are.
Yes,
So
how
we
to-
know
how to access
how to access them.
Absolutely.
Exactly.
Do you have, to that end, do you have a mission statement or any literature
Nice.
It's
that
on your
would
website.
define, or that we could use,
Yeah.
that you'd give us
Did we
permission
not-
to use? Because
We
that's.
do, we have a form.
We have that
It's
form.
already
They
been
should
voted
send
on.
that
I will
form.
get that to you, if I can, I will get you that form, because that's part of what we were using for the database.
That's like the
to put
outline
on
for the
it.
database.
And
Yeah.
it's also a agreement, and it's HIPAA compliant. We don't have any patient and people's names on it, other than the people who contacted let's say VinFin, who are the people dealing with it, what programs you offer, and permission to make that data public, i.e. VinFin has their telephone number, is this, and this is how to reach them, and this is what they do. But it would be public knowledge to get it out there. And also a request that this be updated, and we're hoping to coordinate how that can go out once a year for all the ones that bring them back in, to have it updated. Because when I first started doing this 3 years ago, well actually 4 years ago, with other things, which gave me the interest for it, aside from trying to help patients, is I found one of the databases that had been done. I won't say who did it, but bless them, they did do it. And I thought, oh, it's already done. This is great. And then I found this is 4 years ago, so this is like 2021. It had, the last update was 2015, which is I think what you were indicating. And that was only like 1 or 2 that year. So that's why I put on the form an obligation. Obviously, it's not, we're going to come and hunt you down, but to please try to
Right.
update it on a regular. Anyone that changes to, if you move, for
Well,
instance.
would that be on us to kind of initiate that and just keep the database
Well, that's
up
why
to date?
we're asking for, because if we're going to put it on letterhead, we need to be the means of doing that through the town. We can't really send that out from our home, so it'd be a matter of it to have it out.
But could
we're
we
working
call,
on that.
could we just call, I mean,
We
for
could, we
other,
could,
like,
yeah.
I think the town of Falmouth, there was like a youth worker that coordinated they had a grant, and so she called different people that specialized in different areas.
There's a big
Yeah.
grant right there, $2.7 million.
Yeah, that's right, 2.7.
Now, question, I don't know if it can be done, but we're gonna send them that sheet for the,
I'll send the form.
if you wanna make copies, if you have other agencies that you work with, that you could, pass out, hey, listen, we just got this from the Human Services Committee, they'd love it if you filled it out as well. We'd like to get as much information as we can.
Which is why we've asked for the means here to have a place for that form to come back.
Yeah.
So we're working on that. Anyway, so what VinFin does is outstanding, and actually and also outreach. And what they all do is outstanding, because it helps to meet a need that is, I won't say it's thankless, but it's, it can be frustrating because of trying to meet all the ends and not having the means to do it, and trying to see some things go in circles. But
Yeah, although there's a saying in the recovery community that you're 100% invested in the process and uninvested in the outcome, and that, try to remember that is,
I like that.
and that I always think I'm 100% invested in the person.
Yeah.
And that they are, first and foremost, you're there because you care about them as a person and their experience. You're not going to be able to create housing. You're not going to be able to suddenly alleviate years of living with mental health or substance abuse issues, but you are going to be able, to see whether or not what's possible with them. And if they need some support, then we try to be there for them and figure out what you know, what's gonna give them a sense of hope or get them access to services. And we try to reduce and remove obstacles and barriers for them, right? And because again, we're supposed to be identifying people, what are your needs, what do you wanna do? And then how do we make that happen? And then, you know, but right now the demand is high, the volume is growing, and the services, if we can at least know what the services are,
Yes.
you know,
Yeah.
That's exactly right.
and then,
I think Donna and Robin, you said something right there about you're mainly focused on them to help, you know, with their needs. For this committee, at least my part, I want to be your backstop. I want to help you in any way we can
That's what
to
we're trying
make
to
it
do.
easier to do which I think is God's work, helping those in need. So that I can't do what you do, but I can do my best to try to make what you do easier, the behind the scenes stuff. So that's what I would love to do for you and to help out, not only your agency, but all the agencies out there. So that's why we want to be your resource to come to if you need it.
So I am hoping that at the May meeting, if not at the very latest, the June meeting, we want to have all the entities who have presented to us, which are the key players, Vinfin being one of them. There's so many more, and we'll invite the others as well. But to try to get together and try to put, I mean, the database is obvious, that's what the form, but also some of the, try to put together a proposal on coordination. That's one of the tough ones. There's two tasks here. One is the database, and that will happen. Vinfin is on my one. And it was on the one that wasn't updated in 2015. The
It
information
wasn't on the one
just
that
wrong.
I
Yeah.
shared with you guys before. That was
Okay.
like that baseline.
But I think that
Wasn't
was
there?
based in Bourne though, wasn't
Yeah.
it? Yeah, whereas mine was based on Barnstable.
Yeah.
But, so,
can I suggest though, if you're gonna ask about coordination,
yeah,
that you have people at, we go to everybody, I'm not, cause I'm a clinician, but a lot of folks go to a lot of meetings already, there's actually a lot of service meetings, that people maybe submit something in writing about what they think would help with cause we all know who
Yeah.
the player, we all talk,
of course.
we're at the same outreach or we're
Yeah.
in communication at different meetings, what they think coordination, the best way to do coordination,
Yeah.
To minimize duplication of services and to deal with volume and also to, what do we do if people are falling through the cracks, you know, like.
Yes,
On that form we're going to send you, I believe there's a question very similar to that on there already. But we should look, and if not, maybe we can just addend.
the first one, but not the second, and I like that second one. How to best prevent falling through the cracks.
Yeah.
That's not on there. With your permission, I'm gonna put that on there.
For small fee.
There's a lot of work to do. There's a lot of work to do.
Well, that's why, such a part of my mind, sorry about that, I have to scribble fast. That's why we try to identify, not to minimize any other group, but try to identify the big key players. Vinfin being one of them, Outreach being one of them, Bayco, Duffy, Hospital, 460. It was Brightview, unfortunately, they're not on the Cape anymore.
No,
They've
but
closed down their doors.
Cape
Also-
Behavioral,
Cape
you're here,
Behavioral, Cape Behavioral,
Northeast.
I'm with them now.
Yeah.
You know, so bring them together and, because once after we get the key idea down, I'm not leaving any of the others out, it's just so that we can then bring the rest in. We could spend the next 10 years bringing all the groups together.
Yeah.
Easily.
And again, this guidebook, so to speak, is not only for, we're talking homeless now because obviously that's the client that you deal with, but we're talking seniors, we're talking
Human services.
opioids, drug addictions, we're talking everything. So I mean,
Yeah.
you know, we make sure that
It'll
there's
be
a,
expanding. We've also got on their schools, we've got some of the, the other one we need to get on there is interpreter services. That's something I've earmarked has to be on there, that is not on there. But it's a start,
It's a
which should be constantly updated, which is another reason why we had asked, you know, somebody to keep putting them in, because whatever. Anyway, I wanna thank you guys very much for coming.
Lot of great
Thank you.
information. Thank you very much.
Well, and a lot of great work.
I'm sorry we're peppering you with all these questions,
Oh,
but
no,
we're just
that's
trying to
okay.
learn.
Yeah. Well, that's good for us to remember. Sometimes we get so lost in like where we travel, we forget it, like to let other people know and try to explain what we do and explain what, honestly, kind of what some of the folks we work with, what they're up against. And so the only way to do that is by, letting people know.
Yeah,
So.
well, we're glad you came. Thank you very much.
Thank you.
Donna, Robin, do you have a spare business card? I know I had one of Donna's before and I scribbled Robin's on there.
Yeah,
I'm trying desperately to find it.
I left mine at the office.
Well, Robin, I can call you and get Donna's information, because I wanted to call you and just
absolutely.
remind you about today, and I put it in a place where I wouldn't forget where it was, and that was driving me nuts.
Of course you did. That's why you don't know where it is.
That's exactly right.
Someplace safe.
If anybody wants one, there's a
This makes
file.
perfect sense, never to be seen again.
Yeah,
Oh, we're taking one also?
pick a card, any card.
Did you write yours in $100
Joe, you can have the
bill
pile.
for me, please?
Do you need her card or you good?
I'm good.
Okay.
But no, Patrick might.
Patrick, do you need a card? Oh,
Yeah, but-
thank you. I was trying to do a bartender thing, but it didn't work.
That's because you're not a bartender.
That's a good point. I just drink at the bar the bartender works at.
You're welcome to stay.
I gotta get home to my dog, sorry.
Oh, I know, I haven't fed my dogs all day. They're gonna be angry.
85-pound rescue dog.
Oh, cool.
I have 2 Jack Russells.
Oh, wow.
Yeah.
I have a yellow lab and a cat who rules the 80-pound yellow lab.
Actually, you could put a saddle on her dog and you can sell Ryan.
Nice.
Yes, you're right.
Found Yorkie.
Aw,
He's cute. He's like,
portable, that's good.
thank you. Have a great evening.
Okay.
Drive carefully.
Nothing wrong with
Okay.
kitty cats.
Have you had notice from the town council? You're going before the town council and you've been to the appointments committee again, right?
Yeah, I don't have to go, I think my name's going in front of them.
Okay, because I know that it was already approved from the appointments committee and it just had to go
You'll
before the
have
town
to have
council.
2 reads.
Yeah, I was gonna say, it'll be 2 readings.
Yeah,
Um,
a month away.
Yeah.
I'm gonna do, have you already had one reading?
No,
I
not
had
yet.
No.
I had the appointments one. Go
I'm
ahead.
gonna do a request for one and done, but it's just a
Oh, it's
request. I
2
don't-
through the council?
Yeah,
Yeah, they don't like to do that.
they do a reading and then they wait for the next meeting and they actually read the second
Well,
time.
I can do a request, that doesn't mean, it's up to them. Simple, I'm waiting so long.
Yeah, Betty.
Anyway, back to the agenda. Approval of the minutes and Mr. Taker, any changes to the minutes?
I was not here and obviously there was no video last week, so I'm out on that.
Okay, so. Okay, anyone want to make a motion that we approve the minutes?
I make a motion, we approve the minute.
Is there, oh, actually, we can't because
Right.
we only have, we only have 4 here for a quorum. So I'm gonna motion that we put those off to the next meeting. The other thing is the hybrid meeting possibility. I did check on that as promised. Right now, they're getting preference for the ad hoc, I'm told, so they can't really give us, and the town council and the ad hoc for doing the hybrids. So we don't have that option at the moment. It is my understanding that's always up to change in the future, but it hasn't yet, which is a shame because when Sherry Kay's in California, we can't include her, but, sometimes they call in and sometimes Kim calls in.
Yeah.
So that's the update on that, so not yet.
Do we have an update on whether we're gonna add that second meeting on a Monday?
No, I have asked a few times about that, and I think that is still in the process of being decided upon. As for we do have an update, we are on camera tonight, which is great, so hey, progress is progress.
Didn't know that.
It's been on you the whole time.
That's right, you came in after we made that announcement, so just to let you know, it used to be that these things in the desk would where they had the microphones, but now I'm not sure why they did it, but I mean it's great because it serves well. It's in the ceiling.
Oh, I noticed it.
it does mean you have some interesting interpretations on the captions that come up, but
Oh, I believe so.
yes, but it is what it is. They already know what it is. Membership, I think we just did with Patrick, bring up where that is. We've already gone over the cataloging and that, no roles and reports. We've had the guest speaker, I hope nobody minded that I went ahead and let them do their thing first. rather
No, that
than-
was good, that was new information.
It was great. Public comment, anyone for public comment? No, Betty, did you have anything you wanted to say as town council liaison?
I don't know, I've just been looking at this Barnstable County stuff. I hope we have a discussion about this.
Okay, we can do that before we close.
Yeah, I just, I'm looking at this and I see the usual suspects here. I
Okay.
mean, they get the 2.7, so it goes to, Barnstable County. I'm not sure what they do. They have a website here to look. Really like to look to see how the apportionment is. Housing Assistance Corporation, Catholic Charities, of course, because that's how they're running the shelter, the Duffy Health Center,
Yep.
Mass Department of Mental Health, Sandwich Housing Authority, which begs the question, why isn't the Barnstable Housing Authority getting any? Which is something I'd like to know, because why isn't our housing authority?
I talked with county, and they have directed me to certain sites, and that's what I'm doing. I'm
Yeah.
digesting this now. There's 3 other places to go to find out similar information.
No, but did we not ask for it? I mean,
That's
that's.
what- yeah, that's my
That's
question.
what we're doing, we're
Yeah.
formulating the questions. I don't want it to be just questions from me.
Yeah, no, I'm not, I'm
Yeah.
just bringing this up as I'm looking at this.
Well, yeah,
And then Independence House, which I fully understand. It says all of whom were funded as requested, so it sounds like whatever they put in, they got.
right.
But this is, again, it's the usual suspects, and I just wonder what else is out there, based on what this committee is trying to do. And then the next thing you have, Cheryl, in here was the survey that was done. It's already closed, which is very valuable data. It has to do with the creation and preservation of affordable housing, which is all about what our housing production plan is. So I'd love to see the results of that. I wasn't aware of this. I wonder who they talked to. Like, who did they talk to in the town of Barnstable? I don't know.
It looks like it was a survey that went from February 15th to March 7th.
Correct. But who answered the survey?
Does it say their results on it?
Completely anonymous and confidential, so I
Right,
don't know.
anonymous and confidential, how's that work? Right?
Yeah.
I don't know.
I know what pages, I just don't know what pages.
Yeah, no, I just,
The survey was accessed online, so I gotta be honest with you, I didn't hear anything about
I
the
didn't hear
survey.
anything about this,
Yeah. I
so,
didn't
but
either.
anonymous, how does that help? I mean, in terms of trying to, get accurate data. I mean, I'm a data wonk. Without data, the decision process is not gonna be valid. You need to have this is really important stuff here that the county's
is.
doing. And, so I just,
Well, especially because this survey is gonna help to allocate future
that's
funding
what I'm saying,
across the Cape, so yeah.
yeah.
Well, or was
So
it
who's
filled out
filling out
filled
the
out
surveys?
by other?
Who's
by
aware
others
of the
here?
surveys?
I don't know, it
We
says
don't
it's
know- we don't-
anonymous,
we
so
don't-
it doesn't
yeah,
sound like
could
they
be
went to any
anybody,
kind of municipal authorities at all. I mean, I don't understand the survey.
Back to your thing about these organizations that receive part of this
Is that the only
2.7
ones that
billion.
got it? Yeah.
Well, here's my thing, if you look at these, in my opinion, I could be wrong, Housing Assistance Corp., Catholic Charities, Duffy, Department of Mental Health, Sandwich Housing, Independence House, they all have somebody who is in a position of authority
right.
that is going to fill out the grants, fill out the
Well, that's
applications.
what I'm saying. Did the other
Unfor-
people not participate because the clue bird didn't fly
Or
around?
Correct.
why didn't,
Yeah.
did they not, were they, like us, not aware?
Like, for example, for the town of Barnstable, is there a point person that should be
And I
getting
see
that?
Sandwich Housing Authority and
Right.
and stop.
Right, so that tells you the
begs the
town of Sandwich
question.
has somebody there that is
Yeah.
responsible, yeah.
There's a question here that comes to mind, and that is, one of the reasons, I mean, aside from the fact she's a fabulous individual and she knows what she's doing about, and she's well familiar with the legal and everything else, Sherry Kay, one of the things is she spent like 40 years doing grants and overseeing with businesses and that, and on the basis that if we ever were able to,
Yeah.
with regard to a program, with the permission of the town council or whatever, and they probably say it has to be done by the town, we don't even know where that goes yet or how that's done. That there could be some guidance from this committee or input from this committee with regard to a program if they saw fit to feel that that was acceptable, which we don't know.
So, can I ask a question? Is there a relationship between Barnstable County government and the town of Barnstable where you guys meet occasionally and talk about things that are going on that?
Not that I'm aware of, which I
I'm not
think is
aware of it
really
either.
pathetic.
That would seem like that would be a good idea, especially
You
the
have
biggest.
a representative there,
Okay,
okay?
Who is that, do you know?
It's Frank Frederickson,
Oh, yeah.
the police chief, former
Oh, yeah.
police chief
yep.
from Yarmouth. He was elected this past fall.
So he's the connection between the town of Barnstable and the,
I don't know that.
okay.
I don't know that he's the connection.
It just seems like,
No, I find it disturbing.
yeah, it seems like
We
a
don't
closer
seem to
relationship.
have any
So
kind of relationship.
I
That
agree.
might be one of the things to answer for next time, try to get some clarification
But
on
it sounds to me like that's the only place you guys can plug in, is the county.
The Human Services Committee / Department can plug in, yes, I agree.
Advisory.
Huh?
I agree, but is it,
No, but for now,
Is it
since there
very-
is no department,
Right.
I know,
why can't you plug into the county? What would
because
be wrong with that?
I personally don't think anything's wrong with it, but because we are appointed through the appointments committee for the town of Barnstable,
Yeah, but you
is it
plug in
something
nowhere.
they say that we're not supposed to do? Because we are an advisory committee, not one that makes a decision, so we'd have to clarify around
But you
that.
advise no one.
Well, no, that's
No,
what we
no,
advise
I'm
the
being
town.
honest, you
No, no, no.
advise-
Advise the
no
town
one.
council of a proposal,
What does the
that's
town,
what's clear.
town council does nothing with human services.
I agree.
Name one time anything has come before us,
Well, according to our,
other than
Agenda
hearing
here.
about the opioid settlement, but again, we had no role in that, we sat there and listened.
we're supposed to send to you a report that we will present to a town council
The proposal.
about the proposal of what our thoughts are as the Human Services Committee. And that's when you would then act
Exactly.
on those proposals and say up or down. So that's why
Well,
it's a
that's
position.
where I see it
They
as well,
better
that's
be
where it goes.
actionable.
Correct. These are going to be,
Actionable,
these are action
okay?
plan kind of
We
things,
don't
yes.
need,
But it's not the action that we take, so Betty, the way I understand it, and anybody on the committee, including Patrick, it was only in the vote, I can't until you're on.
why is Patrick over there? Why-
Because there are other people in between,
Antisocial.
and I promise we don't bite, but it's because other people were in.
Oh.
I think we're on the same page, it's a matter of, our thing is advisory, to put a proposal before the town council. And I think if we can put together and coordinate something that will possibly help significantly the town, which is the goal of everybody.
Yeah,
Then, and we can propose that perhaps this can be done with Human Services interacting with county, as opposed to just going to a meeting and finding out what's going on, but also coordinating that way. But then I think, is there a conflict, so that certain things there, answers
Who would
need to
you
be
ask to
sought.
find out? Who would be the person?
Well, I'll be asking our town council liaison.
I think, again, this is one committee person's,
yeah, but you need, as I say,
I
it
understand,
has to
but what
be
I-
On camera
executable,
opinion.
actionable.
Yeah, we
I
need
don't
to
want to-
move.
Need some philosophical.
No, you don't.
I
But-
agree.
but
That's,
No, no,
and
we're
that is
gonna-
often the problem in human services.
Yes.
We'll come with the
It's not concrete enough.
We'll come back
We're
with
gonna
the
come with a
concrete.
proposal that will have actionable steps that can be taken.
Yes,
But in all honesty,
And our
it's
recommendation.
just right. But it's just gonna be a proposal and our recommendations.
Yeah.
You, as the town council, will be the one to say up or down.
But we haven't made that proposal and we
No, we're
haven't.
formulating
that's what
that,
it's
so
coming-
so it's an informed proposal.
Correct.
That has backup on statistics and meaning, and put it forth, and that way we will have done what we're supposed to do.
Yep.
But we have to remember that we are advisory. There's a difference in the town on the committees and the commissions, just to clarify. There are regulatory commissions and there are advisory. I don't know if there's any commissions that are advisory, but entities. So advisory and regulatory. And the regulatory make the decisions for the town. That would be like the airport, that would be zoning, that would be
Planning,
planning, it would be
HHTC.
BHC.
Why don't we
think
create
we're aware
a
of,
proposal for it to be that?
We need to do.
Pardon?
let's do
Why
it.
don't we create a proposal?
Let's do it.
That's
to
what the
be
plan
that?
is, that's what the plan is.
Just jump all the
That's what we're doing,
nonsense and
that's
just
what
be
we're
like,
doing.
look, we wanna be in charge, you guys
And the
wanna be in charge
advisory,
of.
Well, you gotta
You
be,
normally have to find something in state law to hang your hat on. Most of those you're talking about come from state law.
Yeah.
I mean, most towns have one, don't they? I feel like there's gotta be a state law that accepts them to have a human services board, so why couldn't?
Well, they have a department.
right, that's,
Department, sorry, that's what I meant, department, sorry.
this is gonna be the town council's decision.
That could be one of your recommendations, is
And
that
again,
there must be a department to move
Yes.
this forward.
put it this way, there's a lot of money coming into this town with grants that are supposed to be going toward human services
Well, look at all
in
of
general.
this going
Opioid-
on.
Correct. So, again, we're gonna put the proposal together, so I don't wanna say too much, but it would make sense to me that one person, one responsible department head would be in charge of making sure that money that's coming in is put toward where it's supposed to be, and then can get in front of the town council at any point and say, here's the money, here's how we spend it.
At least one
Or not
person,
how we
because
spent it.
Falmouth Human Services, looking at that model,
Right.
they have several.
Right.
But not how it's spent, we can't say this is how we spent it, I think. it would
No,
be-
the town-
It would be, this is what we would like to do, we'd like to apply for such and such, because this is how it works out money-wise. We need, an approval for.
Right, but not if there's
for
a,
trying to go that way.
not if there's a person who's in charge of the human services
True,
department.
But it
They
depends-
become
it-
the
it
head.
It depends what their boundaries are.
Yep, but again, that's for the town council, and we will submit this will be part of the action plan, but again, it's all gonna come down to what
The town
the
council.
town
decides.
council believes is the best way to go.
Because this is not a town with a mayor, it's a town with a town council, and it's a
Yeah.
town rule. We have to respect that.
And I respect it 100%, which is why I said if the town council decided, yeah, that human services, that's really not doing that much, we don't need it, that's your
might
that's your
happen.
prerogative. Huh?
It might happen.
It may, and if it does, again,
And then you go away entirely,
we go with what?
entirely.
Again, I think that would be a bad move, but I mean, that's not my decision.
The other committees, though, have paid employees. They're hired from the town. They're not
You
volunteers.
know what, I say we commit to making a plan,
Yeah.
use the
We are.
resources that we have,
Yeah.
and go for it.
I agree.
They can put a lot more time in it, like.
They have staff, they don't
Yeah.
have it paid, like, for example, HHTC, it's volunteer, planning board's volunteer, zoning's volunteer.
They're
But
volunteers.
they have staff that staffs that community, that writes their minutes,
But
that,
you
you know,
see,
stuff
for-
like that.
For instance, I'm chairman of HHTC. If I want to send a letter out, I have to send it through planning, which is fine, we have great staff there, we
Yeah.
really do. I support them 100%, lots of kudos to them. And they send that letter out, they have it approved by whoever it is, usually legal, because it's not many times I send things out, other than things I sign, which is the certificate of appropriateness. However, for something like this, we want to give those forms, and send the forms out, and the updates. And technically on town letterhead, it is my opinion, I'm not an attorney, I wish I had a dime for every time I have to say that during the week. I'm not an attorney, but I would have thought they wouldn't want somebody who is just on the committee or the commission sending it out. That's why it goes to staff, to make sure that everything there is okay to go out. So that's one of the snags we'll have, how to get out those forms, how to get out the
Can
other
they
stuff and the
reviewed by
updates.
someone?
It'll be part of the proposal, I believe.
Yeah, who collects them, who collates them, who puts them into the actual guidebook we're talking about. All that would be a staff person.
And we have somebody for an hour a week to help with that.
Okay.
Yeah.
Anyway,
Bye.
we'll see you.
Bye-bye. Patrick, thank you for coming. I'm sorry it's taken so long
That's
for
okay. That's something I have research we could do in 5 hours.
research on what?
It's
You have to know what it's about.
It's about immigration in the United States and the Netherlands, and I picked the Netherlands, I don't know why. Immigration and terrorism in the Netherlands, there's no research on a.
I can give you a reason for the
Seems like a fun
Netherlands.
place.
When I was last in the Netherlands, it's when, you might remember, there was,
It was like 2018 was the last attack.
I was there.
Really?
With that camp for youth camp, I was about 2 miles away.
I think we're
And
done,
when I woke up in the morning, I was on the ship, I was on a Cunard ship. And when I woke up, there's a message on the screen on the ship's TV. Everyone on the ship wants to express our condolences to those who are from the Netherlands here. And I'm like, oh my God, what happened? But that's a good one to use for terrorists.
Oh, thank you. Have a good day, guys.
See you later, Patrick.
Okay, so, all right, other items not we already did the other items not reasonably anticipated. So, Betty, thank you for all your input. Guys, thank you for coming.
Thanks, Betty.
Great ideas. I love it that you come and you support us and you give all this very valuable information. And, motion for adjournment.
First.
I motion we adjourn, yes.
I second.
All right, all in favor?
Aye.
Thank you.